Paul and I are delighted to have Pam Scott come with us here, an old friend of mine. I haven't seen her in a long time. Good to see you, Pam.
Good to see you.
Okay, well, Pam has got a problem that she's had a little medial knee problem, and we want to watch her walk, and then we're going to talk about why it's on the medial knee when we're going to find more hyperpronation on the left foot. So if we could just get you to take a few steps over here and walk out. And you can see how the left arch wants to collapse more than the right, and it's a little bit more externally rotated. Calcaneal eversion more on the left side. So why is she having medial knee pain? Another right motor dominant thing. She's still got this twist in the pelvis going on like this, but this is an external rotated femur with an internally rotated tibia, causing a tibial torsion there that is a monster, meaning that most of her problems are coming from above and below. So what we're going to do is we're going to first take this torsion out of her pelvis, this anteriorly inferiorly rotated ilium, which is rotating around a vertical pelvic bowl axis, and we're going to take some of this tibial torsion out.